Good afternoon, everybody. Thanks for being here. Hopefully, everybody enjoyed their weekend. Uh, no new deaths over the last 24 hours in Onondaga County. It's good news. Certainly, over the last 2 weeks, we've had a painful loss of life related to a senior facility, and with multiple cases. And just want to continue to think about them and their families as they mourn. A reminder that the virus preys on our vulnerable. Looking at different data points here, testing in new cases. So testing over the weekend in Onondaga County, we had over 4,000 tests, 4,280 to be specific. Our region reported over 6,000 tests since Friday. Again, almost 3 to 1 for what our mandate is. So testing, even though the national labs have been backed up a little bit, the state labs and the local labs are performing well. The national labs have given preference to symptomatic testing or emergency testing as well, so that turn times at the national labs faster. But if you're going for an asymptomatic test, you go to your doctor. Well, your doctor's probably not going to give you an asymptomatic test, but at the Syracuse Community Health Center, an asymptomatic test is really where the backlog has happened, because it's not a priority test. They've been using national labs. The national lab capacity has gotten better. It was a little bit better last week than the week before, but certainly with what we're bringing on for rapid testing into the community's arsenal, we should be in really good shape at the end of the month, and even better shape in September. Looking at hospitalizations, we have 20 individuals in the hospital. We now have 7 individuals who are there waiting for a negative COVID test so they can be released to their senior living facility or nursing home. These are individuals that are no longer essentially needing hospital services, but with the governor's executive order, they need to actually test negative for COVID before they can go back to the senior facility. As many of you who followed these briefings know, it may take a little while for you to test negative of COVID. Each person's different. That just doesn't happen after what you're considered recovered. 4 individuals are in the critical condition in the ICU. Let's keep them in our thoughts. And when you look at who's in the hospital, 17 Caucasian, 2 African American, 1 of another race. Looking at positive cases, we have had 3,373 positive cases since March 16th. That is 4 new cases. 4. Very good number. Actually, I should look, but we haven't had 4 cases in a while. Daily infection rate of 0.58. Our 7-day average about 0.89 still for our county. Out of the 4 new cases, 2 are affiliated with senior living facilities, 1 resident and 1 staff. And the resident was actually asymptomatic. So hopefully that will mean that they will never get serious symptoms. And we had 2 from community transmission, community spread, 1 of which was already in a quarantine. So really, from a contact tracing standpoint, you're looking at 2 cases that you need to contact trace today, which is fantastic for our health department. We're presently monitoring 146 active cases. This is down 27 since yesterday. This is the lowest number of active cases we've had in months, maybe even since March. And we have had over 3,000 recoveries, up 31 from yesterday, 3,032. When we look at who has been impacted by this virus in our community, 1,964 females, 1,409 males, 251 individuals under 19, 645 in their 20s, 461 in their 30s, 412 in their 40s, 502 in their 50s, 393 in their 60s, 291 in their 70s, 260 in their 80s, 158 in their 90s. Couple topics related to COVID in the community. Certainly, yesterday at Syracuse University, 400 students from what are considered hotspot states came back to the community. They had tested negative before they came back. They were tested again yesterday, so we'll have the results there, but certainly there was a lot of planning and preparation into bringing back these students. There will be more students coming back, I believe, in a couple weeks. We've been working with the university. I want to congratulate them on so far a successful transition, and we will be working with the university very closely on the kids who come back from quarantine states off campus. We will have a quarantine unit that will help monitor our young people, make sure they're making good choices, also making sure they have the support they need, as coming from another state right away into a quarantine isn't the most ideal circumstances. Looking at yesterday, we announced we'll have PPE for our teachers. Our teachers are going to be first responders, essentially in their own way now, as it looks like school will move forward. Governor Cuomo will make that final call later this week. But from the metrics that he set forward, when you look at the data, our data is, again, a little bit under 0.9. It's been there. This is essentially exactly where we were with the infection rate when the pandemic started. And think about everything we've learned about the virus and learned about where it hunts and what are proper mitigation and planning techniques that we can use to even bring that risk down further for our students and for our staff in these buildings, which is really important. Right now, we are in the process of doing a child care capacity inventory for the community. Certainly, we talked about what is a very legitimate issue last week related to with certain plans. What are some of the effects of the plans? Some of the effects are there's going to be child care gaps. So with Child Care Solutions right now, we're going through what an inventory looks like. How many inventory slots do we have? In addition to that, my team is diligently working at looking at the various facilities that we have under control to potentially be used with some of these districts in different days when the kids are not in school, where they can be in a safe place and also do the distance learning. We're going to identify the most at-risk children throughout the community. How would you say we do that? We do that based off of various individuals and various families that are using our services. We're then going to try to work with those districts on models that work, including potentially even this facility here. A big data point that I heard from parents, from teachers, and what we've done with other industries as we've opened up is test. And so today I reached out to all the superintendents about looking at testing, about having our emergency management team organize testing going back to school for employees, potentially in some cases high school students, and then what's a strategy look like during the year. I think we heard the governor talk about this. Happy to report I heard from Liverpool, OCS, ESM, the Catholic Diocese, West Genesee, Lafayette, West Hill, FM, Jordan Elbridge, Lynn Court, Marcellus, and the city of Syracuse. These districts are all interested in trying to do something. When people look at it, they hear me talking about why we believe it's appropriate to take that next step in reopening our community. Why do we say that? We say that because the data shows that the infection rate is really at the best level for a sustained period of time now that it has been. That doesn't mean we stop there. What do we continue to do? PPE. We continue to work with our young people. We wear masks. We use hand sanitizer, and we test. And so how do we know that there's not one person in the room of 100 that doesn't have COVID? We test. So just like we're doing with the university students, we're testing these kids coming into the community so we know they don't have it. And then essentially you get a fresh slate. But then we know that the virus, although limited, is still here in the community. We need to not just test initially as school starts, but we need to look at ways and have strategies to test during the school year. So we've heard from some of the districts. We reached out to all of them. We will work with them, probably mobile testing sites certain days. Again, by the time this comes around, we should have rapid testing in place in greater capacities in the community, which will allow us to get back quick turn times and do more tests for this. So that's something that we're doing with our school districts, and we'll continue to partner. Looking at what's going on in Washington right now, certainly they're in conversations as we speak about a federal stimulus. A couple things we like about the bill. We like that there is agreement that school districts need help to implement many of these costs. A lot of these costs that they're dealing with, again, just like your county government, they didn't have those in their budget. And now they're going to be costs moving forward to do out-of-the-box things like that, what we're talking about. In addition to that, it does look like there is some child care money in both bills that would flow through the states. We've talked to the state in our control room call about how would you anticipate if you receive that, flowing it back here, what could some of the uses be. So once we have those answers, we can try to address some of these issues that we have right now related to child care. Some of the things that aren't in the bill right now, obviously, there's no money yet in the Senate bill for state and local governments. The idea that the local taxpayers are going to get left holding the bag on this pandemic is one that's just not acceptable. If essentially the government has been very good at going to the private sector, asking to how can we help keep people working in the private sector, loans that then become forgivable loans. Certainly, if that's the way we want to think about it for your local governments, that's a good way to think about it. The reality is we're some of the largest employers already to date. We have 400 positions that were filled 12 months ago that are not filled today. In normal time, these would be individuals in your community, your neighbors working for us that would be working every day on things that you want them working on. And those would be 400 families that aren't on the unemployment line right now. Instead, without helping, it goes the opposite way. We've already held the 400 spots, essentially cutting them. Now we would have to dig into the bone with people who are on the payroll right now. Just not a good alternative and not a fair alternative. To remind people, we've already cut $30 million mid-year in our budget. That's $30 million. Think about that number and what we've done already while facing and leading not just this county but this region through this pandemic. We're still looking at a $20 million state budget cut mid-year. Essentially, if the state doesn't receive help, we're going to get cut $20 million. If they get some help, maybe we don't get cut as much. But again, not a good option. And we've lost $50 million worth of revenue as of right now with the current trajectory of sales tax and room tax. So certainly you see why it's important that as we continue to make gains with this virus, we try to get different segments of the economy open to get people back to work so that they're putting money back into the economy. And it's all connected. Every decision we make is so connected. So again, I want to encourage the White House, the United States Senate, and Congress to please, with a cherry on top, get something done so that we can start planning on fighting this virus, preparing for a second surge, and focusing on economic recovery, not worrying about layoffs and laying off the same people that we need to do all this work. Saying that, I'll take questions.
Is the $20 million state cut projection based on 20%, the number they've been using?
Correct.
And is this the bill you refer to, the Mitch McConnell version of the bill?
Yes. So out of the McConnell, right now I'm taking my data points out of McConnell. McConnell's bill certainly less generous than the House bill. So in the McConnell bill, there is money for schools. There's also money for schools in the House bill. There is money for child care. There's also money for child care in the House bill. The House bill has money for locals and states, some other items. The House bill, or the Senate bill, has money for more small businesses, which the House bill, I think, will add into. I think they're all in agreement on all that. I think where the disagreement is what the unemployment benefit number will look like. The addition, does $600 a week stay, and will there be any help for state and local governments?
And then testing at schools, the different districts you listed, would that be testing a specific number to see what the infection percentage hyperlocally is? What's the strategy with testing there?
Our strategy, if feasible, and again, we need to hear very quickly from our partners, and they then need to very quickly talk to their employees, is that we would test the employees, all of them, and then with capacity, we then go and we look at some of the high school kids, more socially active, and then we come up with a strategy with the health department with sampling testing in classrooms during the year. And so I think that part of the strategy we need to build out together, and we need to get the parents buy-in on all of that, obviously. But from the standpoint of what we know about the virus is there, as it pertains to Onondaga County, right? Somebody can send me an article from Georgia about kids got it at a camp and school in Indiana. But in Onondaga County, specifically with elementary age kids, these cases have come from household contacts related to their parents getting it. So you can travel any neighborhood. Elementary kids are playing together. In the neighborhood, they're playing with cousins, they're playing with friends. They have not been giving it to each other. That does not mean you don't test. So right now, we view the biggest risk to any individual back in a school building is from adult transmission. Adults are more out and about. Some adults are more social than others, and that's what the data shows us. That doesn't mean that a kid can't transmit it to an adult, but the data shows us the majority of cases are adult to child. So how do you mitigate against that with, I don't know, how many employees do we have in all these districts? Lots. You test them. And so that's how we know that they don't have it. And that's how we find the asymptomatic carriers that aren't sick. And if you're symptomatic, I don't care if you got allergies right now, you go get a test if you're symptomatic.
Would this be before school, before
Yes.
September?
Yes, and you build it into during school too. But I think the goal before school, using the rapid testing infrastructure we think we're going to have in place, you can do that, get it all back in time where it's really meaningful. And I think that's a mitigation tactic that, on top of where we are with our infection rate overall, when you're doing this, you're making sure the teachers have the proper PPE. Face masks are one thing, right? If we're in 6 feet with each other, now you wear a face mask. Other people just wear the face mask if you're going to be out in public. Smart. But face shields was one that certain teachers in my conversations said they were interested in. We got them. We're going to get them to them.
Ryan, you mentioned rapid testing. Who's going to be providing that? And is that going to be just for the schools or other folks who need or want to be tested?
Yeah, so we will, right now, the way, I just wrote this email out last night to somebody, Jim, so I think I got this down pretty good. But if you look at where the testing infrastructure today stands, if you go to a doctor, you're going to a national lab. So unless you're symptomatic, you can anticipate a 7 to 9 day wait period. If you're symptomatic, probably a 3-day period. And if you're tagged as somehow a priority, it could be as soon as 24 hours with national labs as a priority. If you are going to a hospital right now, you're using probably a state lab or a local lab, and those turn times, for the most part, are much quicker. But why would you get a test there? Essentially, if you were doing a procedure, some partnerships with some of the nursing homes and senior facilities, there may be certain cases where We're concerned, even though you're not symptomatic, you had exposure and contact tracing. Those all go to Wadsworth Lab, which is the state's lab, really one of the best labs. So that's kind of how it breaks down now. Your asymptomatic testing right now, really the Syracuse Community Health Center, it's backed up. So what the rapid testing allows us to do is allows us to be a tool to reopen our community, and then to give us another tool for folks to go hunt for asymptomatic cases. So initially, the timing should work out very well with going back to school. So we would use that infrastructure to test employees going back to school, test potential high school kids. Why high school kids? We just saw what happened this summer. Active, socially active, more risk. A lot of these kids who tested positive were asymptomatic. So that would be priority. But then once we get through that wave, you've built up that infrastructure, then you can utilize that. We would continue to utilize that, doing some of our mobile testing, going into communities, and just bringing the testing back to the people.
So when you do the rapid testing of schools, teachers, students, who will actually do the testing?
So we have partners that we'll be working with at Upstate. Again, we talk about the Ronix machine that we've purchased. We're working on another partnership that we're not going to announce yet today, but we'll make that news, but at a different date. But we're building up these partnerships with labs that are outside of this national laboratory network.
As far as this childcare that you were talking about a little bit, are you working with schools on that? No.
What we're doing right now is we're looking at, we're going to need to work with schools at some point. But right now, what we need to do is we need to identify how many families that qualify today with one child have more children, because essentially they're going to be going into these existing slots. Then on top of that, how many slots are left, if any? My understanding will be there'll be very few. What we then need to then do is figure out our most at-risk youth related to who receives services from us, who has CPS, ever had a case on, what households. We then need to figure out alternatives to sitting at home. And people, I think, got confused with some of my commentary over the last week related to this. Why do we speak to this issue? Because we have the governing responsibility for the safety of children. And so one of our greatest partners in this, who are our eyes and ears, are actually the teachers and the administrators in buildings. So in a normal infrastructure, you know that during the hours of X to X, you know where the children are going to be. So what do we then do? We then invest a lot of money to have our mental health workers and our social workers go into the schools. So the teachers are our eyes and ears. They then tell our social workers what's going on. We immediately get in front, make sure they're getting the services they need, but then making sure if there's an investigation, our CPS team then comes in as well. So it's an infrastructure that's proven very well, and that what we credit for rising graduation rates, specifically with the districts that have had strong partnerships with the city of Syracuse. So what happens in a pandemic? The kids got to go home. We shut down schools. I shut down schools. And then we try to keep in touch with the families. It's just, it's hard. It's hard. We are really worried. We know our cases loads are up. We know from some of our partners with McMahon Ryan, Child Advocacy Center, that they're very concerned about abuse. So this is getting to the point where we are now. We're viewing this as an opportunity to get our eyes and ears, our intelligence back in that infrastructure back, so we can try to catch up on everything we've been missing. So that's how it all worked. The pandemic's changed that. Do I think that we could have did some things differently with some of these plans? Yes. That was Friday's argument. I'm on to Monday. Now we need to find solutions. So part of what the solutions look like is utilizing every asset we have available when we know that these kids who really shouldn't be home alone to begin with now are, and now they're going to have a hard time learning. How can we get them in a safe place, in a place that's maybe better for them to learn and get caught up?
Nobody I spoke with disagreed with the heart of your argument on Friday, but some people, teachers, superintendents, found your comments harsh. Over the weekend, did you have any conversations? Have you thought more about the issue? And you mentioned already looking for solutions as opposed to harping on, the past. Where's your head been at since that press conference on Friday?
Yeah, I've had lots of conversations with various professionals, and again, if people took things differently or that too personally, I apologize for that. But in this process, I've been very transparent about every issue facing the community as we try to take a step forward, and we're in a big part of that process, right? Essentially, we're getting people back to, even though our educational professionals have been working, they've been working whole time, planning, getting ready for the year, trying to figure out how to do this distance learning. Now going back into buildings, right? You're getting things back to the community, back to what's once normal. So how do you do that safely? How do you look at it from the standpoint of kids? There's been a lot of voices involved in some of these plans. I felt a need to bring the issue to the forefront because I am concerned about children, especially poor children, whose voices may or may not have been heard in all these processes.
The superintendents, many of them still stand by what they interpret as 6 feet is 6 feet. Have you had any more clarity on if 4 feet is even allowed with masks on?
Yeah. So again, if not all superintendents are saying that, by the way. I spoke to many that understand that you can be within 6 feet in their interpretation as well, but you have to have a mask, and some are questioning if you can keep the kids having the mask on. But I had a conversation with an individual who is very, very high on the food chain involved with these rules, and they believe they gave flexibility in that argument. I understand different officials have said they've had other conversations. I'm not saying those conversations didn't happen. But certainly we think mask wearing is a good idea, whether you're 3 feet, 4 feet, 5 feet, 6 feet, 7 feet.
Cuomo's expected to make a decision on school reopenings this week, and he said today that a lot of parents are still very confused about what's going on. Do you think that's what's happening here? Do you think all of your schools have good plans? And
Yeah, I think the parents got to speak for the plans on how it impacts their families. And what we've done and what we've worked for, and I think the governor hit on this pretty good today. I watched some of his remarks. But we have worked endless hours to get this community back to the point where we believe you can open up these buildings and send back the employees and the children in a safe way. We still believe there's mitigation and there's things we got to do to make it even safer. And when you do that, it's almost, you want a recognition that moves forward, that the community takes that, what is a courageous step forward, because there's a lot of fear, and that fear is real, and there's a reason to be scared. Look what we've gone through, but look what we've accomplished at the same time. So we need to find the balance as a community now. And so what you have is parents. You have parents that each district's plan is different. I can speak to, I have children in 2 different schools under these plans. One school, my son's school, looks like they'll be going to school every day. It's a smaller school, easier to distance. My daughter's school, she's going to be a 5th grader. In that school's plan, K through 4 is going every day. The 5th grade then becomes essentially a middle school age, and she will go a couple days a week. For me, does that impact my daughter? Yes. Is it ideal as a parent that she's not going? No, it's not at all. But I think that's a good plan overall. I think it's a really good plan because those kids K through 4 need to be in a building, and it was a very large school district that did that. So overall, from the county executive, I'm happy with that plan. It's going to be an issue with me. I'm lucky that I have the support system and the resources to deal with this. Not everybody's like me lucky. So that's where the challenge of all this is. And that's not essentially everybody's fault. Guidelines go this way. We just felt that in some of the plans, the data-driven approach wasn't really utilized as much as it should have been. But again, that was Friday. We stand by our position. Today's Monday. We're looking for solutions.
Ryan, at this stage of the pandemic, what's your biggest overall worry about COVID-19 in Onondaga County?
I think right now we've starved this virus to the point where we can do these things, and we can stand another attack or a counteroffensive by this virus right now. And so when phase 1 started on May 15th, we had an infection rate at 6%. Today, we're phase 4.5, phase 4, whatever. We're waiting for a couple businesses to get going here still, but we're starting off talking about schools, big step. 0.9, 0.89, 0.8, depending on the day. So we've brought everybody back. We've done it in a smart way, and we've started the virus. And that's really a credit to the health department and Dr. Gupta and her team, my team at the health department, because they're contact tracing, they're quarantining, and then the community takes it seriously. And people aren't messing around for the most part, and they're doing their job as citizens. And when you do that, you get to where we are. So I think in the 0.9, Jim, I think this is important, because we talk about this in the control rooms. In that 0.9, included in that is what? Community spread numbers, our senior facility numbers, some group home numbers at times, and travel numbers. So in this process, in the beginning, we saw just community spread and then travel related. And then when we had the massive spike is when our senior facilities were impacted. And then we've brought down the community spread numbers, and we brought down the senior numbers, and we continue to bring them down, but we've brought in the travel numbers because people are out going on vacation. Yet our numbers haven't moved up, because it shows you the progress we've made. So I think we've gotten ourselves in a position where by going back and doing the things we've done to get us here, we shouldn't see spikes if we're smart. But I think that takes a lot of work. So it's going to take a lot of work with SU constantly, Lemoyne, ESF, and with the school districts. But it's work that our team's up for.
One of the SU students we spoke with, he is an off-campus student, and he was from, I think, South Carolina, one of those states, and he got tested. He came here. Before he quarantined, he went to McMahon's and Target to get all this stuff. Now he's quarantining. But the question is, he doesn't know when he's going to get tested again from the school. He's like, I don't know when they're supposed to send it to me. I'm not sure. So are you hearing confusion from that?
This individual probably got here because his lease off campus probably started before, so he could move in. Essentially, my understanding is on the 17th or the 16th, I'm not sure what day, is when most of these kids are supposed to be coming in. So if this young man wants to get, or a young lady wants to get tested, we will arrange one for them. But essentially, most of the off-campus housing is coming in later on in the month. What will that look like? They will get a quarantine notice from us in the health department, just like someone who's been exposed to COVID. We will explain things. We will have a unit working to make sure that they comply, but also that if they need help, they have the help, and we communicate that with the university because they're part of our community. And by doing that, we think we'll get through the 2 weeks. Certainly, we've talked to the chancellor and the mayor and all of us about some of the parties that we like to know, that we know go hand in hand with college experience. The experience is going to need to be modified until we get a vaccine and an antiviral treatment. So that's something that bad news for some of these kids, but they should be used to that to a degree from wherever they're coming from. So that's going to be work, and that's something that we're up to. And why do you do the work? We're a college town. We embrace these kids. These kids go to our census numbers and our population because they're part of this community, and they're a big part of the economy. And so you figure out how you can do it. You do it safely. You enforce the laws to keep people safe, and then we have a success story to talk about.
You talked about the college kids and the high school kids being more social and that's spreading the virus a little bit, but these elementary school age kids have been kind of stuck at home. They're more under their parents' decision making, and most camps are closed and playgrounds are closed. So how are you so confident that when they get back in the classroom that they won't start the same kind of spread that the high school kids or the older age kids have?
Well, I'm glad we haven't seen a spike in elementary age kids with high school and college kid behavior, Trish. That is, we know why the high school kids and the college kids and the 20s are getting this virus. They are more socially active, spending lots of time together and not physically distancing at all times. So what we've seen, I can just speak to the data. And that's, again, this is the data in Onondaga County. And if someone doesn't like what I'm going to say, they can go find something on the internet and they can go blast it. They should accreditate that source, but they can do that. Kids are getting together, elementary age kids. They are playing. We know this as parents. They're getting together with cousins. They're getting together with neighbors. Hopefully they're not in mass gatherings of over 50 people. But if you go to a barbecue and you have a family and there's going to be 4 or 5 other families there, you're not leaving your elementary age kid at home unless they have a babysitter. And that person who's babysitting has been gathering with people. So the infection rate in the community is 0.89%. So the risk is essentially that percentage. The percentage of how many elementary age kids that have gotten it out of our 3,300 plus cases, 3,373, I believe is under 1% of the total number. And when you trace back how they got this virus, it was basically from mom and dad. So that does not mean that they can't get it from another kid. And that does not mean if somebody's symptomatic goes to school or is asymptomatic that they can't spread it. We had the cases with the daycare facility. It can spread. We know that. But this is the data. This is the overall picture, not the one specific case. So how do we improve off of that 0.89%? We make sure that everybody has the proper PPE. We make sure that there's hand sanitizer in every classroom. We make sure that we're testing, not just at the beginning, to make sure nobody's walking into the buildings with it, but we have a strategy moving forward. And then we've done really the best we can do. And it's about living with the virus. And hopefully at that point, once you do all that, that infection rate or that risk to that teacher, that administrator, that child is much less than 0.9.
Where do we stand with gyms?
They are modeling out different scenarios, is what we're told. We're also told they're looking at potential different geographic potential regulations. I don't really understand what that means yet, but the fact that they're looking at these examples, I think, is a positive sign. So again, it's that I've talked to a couple bowling alley owners the last week, people saying, I'm going to lose my business if I don't get an answer this month. This is dire, and we've explained that, and certainly our position is that let's regulate these companies, make them do things safely, but let's give them an opportunity to survive as well.
Did you have a control room call today?
We did.
Is that kind of the gist of it?
Yeah. Talked a little bit about the governor going to make a decision later this week. I think the governor talked a little bit about today, and he's looking at the infection rates. He put out a metric that I think made sense. So I'm sure, their team, I think, has been critical of a couple plans from New York City that they didn't like. So we'll see what happens later this week. But I think overall, if you can't open up at 0.89 for in-person learning, I don't know. There's not a metric you can get to that's going to trigger that. That's just then a decision that's being made. for different reasons than the data.
Have you thought about getting an antibody test?
Yes, they aren't very accurate. There's three. I think Dr. Gottlieb, who I follow on Twitter, says you need 3 of them to get the result to confirm it. I have thought about it. I just read potentially one of my colleagues in Albany County, Dan McCoy, didn't have COVID via diagnostic, but the antibody test says that he may have had it. So I don't know. I'll have to ask Dan why he thinks the antibody's right.
Were you at any of those conferences that he was at? Because I think I read the article too. That
What? I don't know what conferences you're referencing, Trish,
I think
but
you were at a conference at the end of February in like the D.C. Maryland area, weren't you?
I was.
He was also there.
He was there, but this is the honest truth. I don't ever lie to you. I did not see Dan McCoy in Washington D.C. When I got there, he was leaving, and I do wish I did see him there, but maybe that was fate that I didn't see him. Anything else? Okay, Trish, leave it to you to have the last round of probing questions there. I appreciate that. But thank you, everybody. Again, great news today. I think certainly 4 cases. I don't know when we had 4 cases last. I don't know if it's happened since week 1. Just tremendous work being done by the health department, tremendous work being done by the community. Wearing masks works. It just does, no matter what anyone tells you. So please keep it up, and we'll be able to continue to try to get every segment of our community back and running slowly but surely. Thank you.